flexion, and it's going to be the rectus abdominis. So you're going to have the patient lay on their back in supine. So the testing for this is a little different. First, I want to say when the patient lays down, they're going to have a posterior tilt in their pelvis so that all of their spine and lumbar spine is going to be touching the back of the table. So for grade 5, there is no stabilization and there's technically no palpation, but if you do want to palpate, you palpate it's lateral to medial. So it's the anterior aspect right here. So for grade 5, the patient is going to put their arms behind their head and they're just going to compress their abs up and their scapula should completely come off the table. For a grade 4, the patient is going to have their arms crossed over their chest and they're going to come up again and their scapula should be completely off the table. For a grade 3 plus, they're going to put their arms straight to their side and they're going to come up. Scapula should come up completely off the table. For a grade 3, we are going to have the patient come up, but the upper portion of the scapula is going to come off, but both inferior angles are going to be laying flat on the table. For a grade 2, their whole scapula is going to be laying flat on the table, and they're only going to be able to lift their cervical spine off. Okay. In grade 1, we already know palpable contraction, no movement. In grade 0 is no movement, no contraction. So would you sit up for me? So like I said, common clinical considerations, make sure that their whole back of their spine is laying on the flat table. If not, you can always put a towel under their